I'm Lindsay. Welcome back to my channel all about endometriosis. I wanted to make a video about surgery and having operations because it's a subject that most people with endometriosis have to face at some point, and it can be so nerve-wracking, especially if it's your first operation, like not knowing what to expect, not knowing how to prepare to have an operation. I remember before my first op, I was extremely nervous. Personally, I find any kind of hospital appointment nerve-wracking. So going in for an actual operation, I can honestly say that I was truly shitting myself. So if you're going in for an operation and that's how you're feeling, very, very nervous, know that that is completely normal. There are things that they can do for you if you are extremely nervous. Like me personally, I asked for something to help calm my nerves. They give you something called a pre-med, and that includes a tablet just to calm you down if you ask for it. I was high as a kite. I went from being very tense, shaky, nervous, quiet, all of those things that come across when you're extremely nervous about something, to chatting to everyone, telling them my life story, took a piss in a toiletry basket, the list goes on. I wouldn't recommend doing that, but my point is that these meds will calm you down so much to the point where it's, for me personally, it was like I'd had like 10 drinks, but with no side effects other than being a bit too happy. I mean, these drugs don't affect everyone in the same way. I think I had quite a large dose and I was very small at the time, and it just sort of took me away with the fairies a little bit, but usually the effect of those are that they just calm the nerves, get rid of those. The few days running up to surgery, I think it's probably best if you get yourself just ready, pack a bag, especially if you're having surgery for endometriosis. There's certain things that you need to remember to take to the hospital, like a pillow for when you get picked up, because when you put the seat belt on, and the end of the seat belt is going to be over your wounds, so to put a pillow in between your seat belt and you just takes away some of that pressure. Remember to bring loose clothing. You don't want to be coming out of surgery all bloated up and full of gas and be trying to squeeze into your good tight jeans. So remember just some like loose trackies or pyjama bottoms, whatever, and a loose top to go with, just to leave the hospital basically. Remember toiletries in case you end up staying overnight. Don't forget your toothbrush, slippers, anything that just brings a bit of comfort to you. Obviously you're not going on holiday, but anything that makes you feel comfortable. Your phone charger, very important. So remember sanitary pads, but the hospital did provide me with those. I took snacks with me. I was a bit worried about the hospital food because, well, that kind of goes without saying, but luckily the hospital food was actually quite nice, so I had that and my snacks because I was just a bit peckish. They do say just to try and get back to normal with your food as quickly as you possibly can. I went home and had a pizza, but do remember that your bowels may have switched off, like mine did, for about a week afterwards. The best thing that I found after surgery was anything peppermint, because when you go in for your op, they expand your insides with gas, and the gas stays inside you. They don't do anything to obviously clear that out. So my best friend became peppermint capsules, and I absolutely reeked of mint for about 2 weeks afterwards, but the gas kind of gets stuck inside you if you don't do anything to help clear it, and it was all like up in my shoulders and everywhere, and it can unfortunately become quite painful. But anything peppermint brings a really nice relief for that. Remember underwear, face wipes. Some people like to bring a bit of like chapstick sort of thing. Personally, I took a whole bag of makeup, but that's just me. You do you. If you want to put your makeup on after your op, you do that. And just remember that it is completely normal to feel apprehensive, nervous, worried, and don't rush yourself out the other side. Everyone recovers at different rates, because obviously endo is diagnosed in different stages. which obviously has an effect on how much you will have done during surgery. So don't feel like you're not getting better quickly enough, or compare your recovery to anyone else's. Something that we've been talking about a lot actually recently, with my endo sisters, is that a lot of medical professionals give very unrealistic recovery times to endo patients. And it's almost like they just give like a one-size-fits-all standard timing. That is just like a base time frame, and then you can then extend that time for as long as you need by contacting your GP and requesting sick notes if you're being expected to go back to work and you're not ready. Give yourself all the time that you need, because your body will thank you for it in the long run. I was in surgery for a couple of hours, and I was really, really scared about the whole going to sleep thing and everything, and the anaesthesia. But it honestly, you've probably heard this time and time before, but it is honestly like you've just blinked and woken up again, like you know nothing about it. I had so much anxiety surrounding my actual surgery day, and it just wasn't what I anticipated at all. It was a breeze in comparison to what I was worrying about. But yeah, don't be afraid to ask any questions to anyone that's already experienced any of these things. Also, don't be afraid to get in touch with your doctors or the hospital that you're going to answer any questions as well. Anything that's going to put you at ease, just reach out. Don't be afraid to do anything that you need to do to make yourself feel better in any way, either before surgery or afterwards. And go easy on yourself, be kind to yourself, and just give yourself all the time that you need, because you deserve it.